Another devastating day across the country in the coronavirus pandemic. More than 2,000 COVID-19 deaths reported in the U.S. yesterday, according to Johns Hopkins University. Since the pandemic, there has only been 20 other days where more than 2,000 American deaths were recorded. The last time numbers were like this was in May. It also comes as a record number of people are being hospitalized across the country, and just before a holiday. So as more and more people are getting tested ahead of that Thanksgiving holiday, we continue to get daily updates on the coronavirus and its impact here in Arizona. So Gina has a look at the numbers this morning and the positivity rate going in the wrong direction, right?
Yeah, you know, Olivia, I don't want to sugarcoat it. We'll just get you the facts. The numbers don't look great. So for 7 weeks in a row now, we've seen our average positivity rate climb back up, just as Olivia was inferring to. So we went from 4% in the first week of October, but now our average from Sunday sits at 13%. Last week's average was at 12%. So once again today we are seeing yet another bump up in our average positivity rate. Now, if you look back at the number of cases that we saw 7 weeks ago, our daily total for cases was at 604. Today, we are reporting more than 6.5 times that number from the Arizona Department of Health Services. Today's daily total, 3,982 cases. Monday, we passed the 300,000 mark for total cases since the start of the pandemic. We've now crossed the next milestone with more than 310,000 cases across the state of Arizona. Sadly, another 9 people have lost their lives to this virus, and that means 6,524 Arizonans have died because of the virus. And in the next several days, we could see our testing numbers go up as folks scramble today for last-minute COVID tests ahead of the Thanksgiving holiday. We're going to take a closer look at these numbers, also take a closer look at the impact on our hospitals in our state. That's going to happen in the 9 o'clock hour.
Gina, thank you. So right now we're keeping our focus on how Arizona is faring in the pandemic, and we always want to get answers from the Department of Health Services, right?
Yeah. So we are taking our questions straight to the top. Kylie joining us now. She is talking with the Director of the Department of Health Services, Dr. Cara Christ. Kylie, good morning.
Good morning, and we do have a lot of questions to get to because this is a topic that we keep on discussing, and there are so many different facets. First off, we want to introduce you to Dr. Cara Christ joining us this morning ahead of the Thanksgiving holiday. Good morning. Thanks for being with us.
Good morning.
Thanksgiving is tomorrow. Sky Harbor Airport tells me 70 to 75,000 people will likely go in and out of the airport today. Is that more concerning than the indoor gatherings, or are they both very concerning for you as a health expert?
I would say that they're both very concerning. So having gatherings of more than 10 people puts people at risk for potential spread of coronavirus, but also people coming from places that have higher transmission than Arizona does right now, potentially bringing COVID into their families when they may not have been exposed.
We have seen 4,000 cases a day or a little bit more. Do you think in a week or 2 weeks we're going to be at 5,000 to 6,000 cases each day?
So we have been concerned about the upcoming holidays. We know that people like to gather. This is a very, this is a very important time of year for a lot of people. So we are afraid that we are going to continue to see an increase through Thanksgiving unless people take precautions while they're celebrating.
Speaking of precautions, we know that a soccer tournament is going to get started on Friday. And there are a lot of youth sports that are still having tournaments. And this soccer tournament, they say they're taking precautions, but there's still a lot of concern. Do you think there should be a pause on youth sports?
So we are cautioning against participating in any large gatherings that involve people that you do not live with. However, we know that some of the groups are doing a great job at requiring masks, physically distancing, reducing observers. They're supposed to work with their local jurisdiction, and the local jurisdiction is supposed to make sure that those plans are in place and being enforced.
Valleywise Health, the chief medical officer, said that Arizona is at a tipping point yesterday. We also heard from Banner Health. They said we could be in a situation where COVID positive staff members continue working if they're asymptomatic. Is it that dire right now?
So right now we're working with our hospitals. We know that one of the barriers could be staffing. So we are working to help get them additional staffing either through a payment incentive or providing nurses and staff directly from the state. That is an issue, though, because we want to make sure that we have enough beds for people when they need them.
Do we have enough beds?
So we currently have enough beds. I think the barrier is the staff to be able to staff them. So that's why we want to make sure that we are protecting our healthcare system. We're keeping Arizonans healthy so that they don't need to use those beds.
How many more nurses do we need for the winter months?
So every winter we do get a surge. We've got winter visitors, we've got influenza, and so it's difficult to tell. We're working directly with the hospitals right now to get a sense of how many nurses they need to ensure that they've got their beds staffed.
If we continue to see beds increase, do you think we're going to have to put a pause on elective surgeries?
So we leave that up to the individual institution. If they get help from us, usually we ask them to either pause or reduce the number of elective surgeries, because that could be staff and beds that could be used for other patients. But canceling or limiting the number of elective surgeries is usually in a hospital surge plan.
I have a lot to get to, but I know we've got to wrap testing. I want to talk to you about this. I've seen the long lines. I have tried to get a test and maybe sometimes haven't been able to. Slots are full this week. I know that a lot of people out there have had maybe difficulty getting a test. Do you think we need more testing? Will there be more funding, especially as Christmas is nearing? A lot of people are going to be tested and want to get tested in December.
So we continue to add capacity in our testing system. We haven't stopped working with providers to add additional sites. So we want to make sure that Arizonans can get the test they need when they need it. One of the things that we would really caution people, we know a lot of people are getting tested for Thanksgiving. Having a negative test is not a fail-safe from preventing the spread of COVID-19, because that was just a snapshot in time when you got that. So we would still encourage, even if you have a negative test, make sure you're wearing a mask and that you're physically distancing if you are with people outside your household.